No matter how well our departments respond to fire and other emergency incidents, each incident represents a failure and subsequent loss, both individually and collectively. The fire service already knows there is more than one way to provide protection for communities. One of the best ways is by combining emergency operational and preventive efforts into a cohesive strategy designed to reach our most vulnerable citizens. Today's fire departments respond to more hazards with fewer resources. Our communities are changing and many are expanding with increasingly diverse populations. Keeping up isn't enough. We have to get ahead. That's why more and more fire chiefs are implementing community risk reduction efforts in their departments.
Community risk reduction helps departments identify fire and life safety risks, prioritize them, focus energy on mitigation and prevention, and become more of a community player in order to reach all those in their service areas. Community risk reduction balances emergency responses with proactive, focused prevention efforts driven by local data, so those efforts are directed where they are most needed.
At Tualatin Valley Fire and Rescue, we use incident and community data to drive both our emergency response and prevention strategies, all with the same goals: reduce emergency call demand, make our operation as efficient as possible, and improve public and firefighter safety.
And involving powerful community allies can help departments reach people they're otherwise missing. That gets results. No matter how small or large a department is, whether it's paid or all volunteer, urban or rural, community risk reduction works, and it can work well in your community. In the UK, this concept is not just accepted, it's law, and it has paid off in dramatic loss reductions. By incorporating proactive home fire safety checks targeted at high-risk populations, the Merseyside Fire and Rescue Service reduced fire incident rates 33% from 1999 to 2006, with a 50% reduction in fire deaths for the same period. More than 700,000 homes were visited and more than 900,000 smoke alarms installed. Increasingly, fire departments here at home are doing the same with similar improvements.
By focusing on community risk reduction, we're not just responding to emergencies. We're proactively adding value to and building equity in our service area. Working with local partners, we can conduct more home visits to reach more high-risk residents. Our American Red Cross volunteers help us access the same number of homes in just one day that would take us a month to reach on our own. Our station health fairs offer residents free blood pressure checks, saving them costly medical visits and creating a direct line between early detection of health problems and helps reduce medical call volume. Any fire department can embrace community risk reduction, improving public safety and adding value to their service area. And when it comes time for budget cuts, a department with a high perceived community value is in much better shape.
You might be wondering how a commitment like this gets paid for. Good question. Start with advocacy. Help elected officials and others in your community appreciate the far-reaching impact that fire and injury have on your entire community. And rely on partners to help meet your community risk reduction objectives. It just makes sense to partner with the local businesses, agencies, and groups that can increase and improve your access to and reach into all populations, especially those at highest risk. By doing this, the fire department becomes a more vigorous and present member of your community, and that's a good thing.
Community risk reduction is not just a phrase, it's a way of serving the public, and any department can gain from embracing it. I'm in a very rural fire district in an underserved and under-resourced area, and CRR has had an incredible benefit for our citizens. It helps us manage risks and make people safer, whether through fire, injury, drowning, or seatbelt awareness. We're showing our community we're doing the very best we can to help them manage their own risks. Our efforts to be proactive in managing our call volume, especially the increasing number of medical calls, is critical. It may not show up on an insurance rating form, but our efforts to improve community paramedicine in Rio Rico draw attention to another form of CRR that the fire service needs to consider. Today, the fire service is asked to do more with less, If we can stop an event from happening in the first place, we've really done our job. Community risk reduction is the concept we are putting into action that helps us accomplish that.
Too often, a fire department's role is limited to suppression and other emergency response, while local agencies follow up with aftercare. We can do better than that. We can work with those same agencies now, before the fire or accident or home injury, preventing it to begin with. And the people in our communities can help us do better. Once a fire department determines what the risks are in their jurisdiction, they can effectively employ strategies designed specifically to address them. Maybe it's home fire safety checks or an aggressive campaign to reduce frequent low-priority calls. It could be an educational event to show how fast a home fire spreads. They might team up with middle school teachers to prevent false alarms, or with high school groups to encourage seatbelt use. Our country has a serious fire problem, and calls for other emergencies are increasing every year for many local service providers. We can't do it all alone, but our departments can become part of the solution. Community risk reduction takes the fire department beyond emergency response. This innovative and outcome-driven approach produces positive results and increases the community's cohesiveness, putting the department in a more integrated public safety role. If it sounds like community risk reduction is just one more job you don't have time for, think again, because it can and will help you manage the risk in your service area. By coordinating your prevention outreach and emergency response efforts, you'll help the people you serve live better, safer lives, and you'll gain new partners in public safety you wouldn't normally have.